Welcome to our video on the 7 signs and symptoms of throat cancer. Throat cancer refers to malignant tumors that develop in the throat, pharynx, voice box, larynx, or tonsils. It's part of a larger group of cancers called head and neck cancers. Throat cancer arises when cells in these areas undergo mutations in their DNA, leading to uncontrolled cell growth that can form a tumor. Over time, these cancerous cells can invade nearby tissues and spread to other parts of the body. The throat itself is a muscular tube that starts behind your nose and ends in your neck. Throat cancer typically is categorized based on the specific part of the throat affected. Pharyngeal cancer involves the pharynx, which is subdivided into the nasopharynx, upper part of the throat behind the nose, oropharynx, middle part of the throat, including the back of the mouth, tonsils, and base of the tongue, and hypopharynx, bottom part of the throat above the esophagus and windpipe. Laryngeal cancer affects the larynx or voice box, located just below the pharynx in the throat. The larynx is crucial for breathing, speaking, and swallowing. Tonsil cancer involves the tonsils, which are 2 lymph nodes located at the back of the throat. Studies show that the 5-year survival rate for those diagnosed with localized throat cancer can exceed 80%, emphasizing the life-saving potential of recognizing symptoms early. However, for those diagnosed at advanced stages, the survival rates drop significantly, underscoring the urgency of timely diagnosis and treatment. In this video, we'll dive deep into understanding the 7 key signs and symptoms of throat cancer. We're here to clear up some of the mystery around this condition and give you the info you need to spot potential warning signs. After all, it's all about getting in tune with your body and knowing when something's off, then feeling confident enough to act on those signals, right? So, are you ready to learn what to keep an eye out for? Let's get started. Starting our countdown at number 7 is the persistent cough. We've all been there. After a bout of the common cold, we're left with a lingering cough that just doesn't seem to want to say goodbye. But there's a type of cough that feels different. It overstays its welcome, resistant to the teas, soups, and over-the-counter cough syrups that usually do the trick. This isn't your garden variety cough that clears up in a week or two. It's stubborn, perhaps even a bit mysterious, hanging around without any other cold symptoms to keep it company. What sets this cough apart isn't just its persistence, but also its nature. It might be dry, or it might bring up phlegm, but the key is that it doesn't seem to be linked to the usual suspects like a cold or allergies. It's like a signal flare, indicating that your body is trying to tell you something important. Especially noteworthy is when this cough disrupts your daily routine. Maybe it's keeping you up at night, making it hard to speak without hacking, or even just persisting in the background of your day-to-day activities. If this cough has become your unwanted companion for longer than a couple of weeks, it's worth listening to what it's trying to say. Persistent coughs can be signs of various conditions, but when we're talking about throat cancer, they're one of the early warning signals. It's your body's way of reacting to something that's not supposed to be there, an attempt to clear away or fight off what it perceives as an intruder. So, if you find yourself with a cough that's lingering longer than it should, refusing to bow out gracefully despite your best efforts to bid it farewell, it might be time to consult a healthcare professional. Sliding into the number 6 spot on our list is something you might not initially connect to throat cancer: changes in your voice. We've all experienced those moments when our voices betray us, turning hoarse after we've spent hours cheering on our favorite team, or belting out lyrics at a concert. In those instances, a raspy voice is a badge of honor, a tangible memory of good times. But what about when there's no concert, no game, and yet your voice sounds like you've just come off a world tour? If your voice decides to take on that gravelly tone and stick with it for weeks on end without an apparent reason, it's like a gentle nudge, urging you to pay a bit more attention. This isn't about a temporary change that fades with a few cups of tea and a day of vocal rest. We're talking about a persistent hoarseness, a shift in your voice's quality that doesn't quite fit the norm, and doesn't seem to be in a hurry to leave. This change can be quite subtle. Maybe your voice isn't projecting like it used to. Or perhaps you find yourself needing to clear your throat more often to speak clearly. It could start so quietly that you're the only one who notices. But here's the thing. If this new hoarseness feels out of place and doesn't fade away, it's waving a flag for your attention. Voice changes, particularly persistent hoarseness, can be a harbinger of throat cancer. It's one of the ways your body tries to signal that something might be amiss with your vocal cords or the surrounding area. Landing at number 5 on our list is a symptom that might initially seem benign, but warrants a closer examination: trouble swallowing. We've all experienced the brief panic of a drink taken too hastily, or a bite of food that didn't quite go down smoothly. Usually, it's a fleeting discomfort, quickly resolved with a cough and a moment's pause. However, when the act of swallowing, which should be as natural and thoughtless as breathing, becomes a recurring struggle, it's a signal that shouldn't be overlooked. This difficulty, known medically as dysphagia, can creep up gradually. It might begin as a minor annoyance, a sensation that something isn't quite right when you swallow. Perhaps you notice it takes a little more effort to get your food or liquid down, or there's a sensation of something being stuck in your throat. Initially, these moments might not cause much alarm. They could simply add a brief pause or a slight adjustment to your meal. But when these incidents become more frequent, transforming from rare interruptions into a consistent part of your dining experience, they suggest something more significant at play. Dysphagia can escalate from being just an inconvenience to causing substantial discomfort or even pain. It's like your body is putting up a roadblock in an area that should be a smooth highway, signaling that something is disrupting the usual path from mouth to stomach. This disruption could be due to various reasons, but in the context of throat cancer, it might indicate a tumor or growth that's physically obstructing the passage or affecting the nerves and muscles that facilitate swallowing. Addressing difficulty swallowing when it first becomes noticeable can lead to earlier detection of underlying issues, including throat cancer. Early intervention can significantly impact outcomes, emphasizing the importance of listening to your body and acting when something doesn't feel right. At number 4, we encounter a symptom that might initially seem like a win, but could be a cause for concern: unexplained weight loss. It's one thing to celebrate the scales tipping in your favor after weeks of meal prepping and hitting the gym, but it's entirely another when the pounds start to shed without any effort on your part. If you haven't changed your eating habits, nor have you increased your physical activity, yet you're noticing a significant decrease in your weight, it's as if your body is sending out an SOS signal. Unexplained weight loss is like a puzzle. It doesn't fit with the rest of your health picture, signaling that something beneath the surface might be amiss. This symptom becomes particularly alarming when it's rapid and unintended. We're not talking about a couple of pounds lost here and there, but a noticeable difference that doesn't align with your current lifestyle or health goals. In the context of throat cancer, this unexpected weight loss can be due to several factors. It might be a direct result of swallowing difficulties, where eating becomes a challenge and adequately nourishing your body turns into a daily battle. It could also stem from the body's increased metabolic demand as it tries to fight off the cancer, burning calories at a higher rate than normal. By taking this symptom seriously and consulting with a healthcare professional, you can uncover the underlying causes and, if necessary, begin addressing them early. It's about taking that red flag your body is waving and seeking the answers needed to ensure your health and well-being. Sliding into number 3 on our list is a symptom that might initially seem more annoying than alarming: swollen lymph nodes. You know those little glands in your neck that sometimes puff up like tiny balloons when you're battling a cold or an infection? They're your lymph nodes, frontline defenders in your body's immune system, springing into action whenever there's trouble. But what if these lymph nodes swell up without the usual suspects, like a cold or sore throat? What if they remain swollen, feeling like little lumps under your skin, long after any sign of infection has faded? That's when your body's usual alert system seems to be sounding a more persistent alarm, signaling that it's time to dig deeper. Swollen lymph nodes, especially in the absence of a clear reason, can be your body's way of signaling underlying issues. While they can swell for a variety of reasons, Persistent swelling without a known cause should not be ignored. In the context of throat cancer, swollen lymph nodes can indicate that the body is trying to fight off cancerous cells. It's as if your immune system has picked up on something it doesn't like and is rallying its defenses, causing these nodes to enlarge. If you notice swollen lymph nodes in your neck that don't return to their normal size, or if there's no recent history of infection to explain their swollen state, it's a clear cue to seek medical advice. This symptom, particularly when occurring alongside others mentioned in this countdown, adds a critical piece to the puzzle. It's your body nudging you to pay attention and possibly uncover something that requires timely intervention. Cruising into the second spot on our list is a symptom that might catch you off guard: ear pain. It's easy to brush off ear discomfort as something minor, perhaps expecting it to vanish as mysteriously as it appeared. Yet, when ear pain persists without the usual suspects like an ear infection, it's time to tune in more closely to what your body is trying to communicate. This kind of pain, especially when it's concentrated on one side and doesn't bring along the telltale signs of an ear infection, like fever or fluid drainage, might seem out of place. However, the explanation lies in the intricate network of nerves shared between your ear and throat. These areas are more connected than you might think, allowing issues in one area to send ripples of discomfort to the other. Persistent, one-sided ear pain without a clear cause could be your body's way of hinting at trouble brewing in your throat. The interconnectedness of nerves means that pain originating in the throat can manifest in the ear, misleading as it may seem. So, if your ear is persistently painful, especially if it's just on one side and isn't behaving like a standard ear infection, it's worth getting it checked out. After all, when it comes to health, it's the seemingly small signs that can sometimes speak volumes. And here we are, at the top of our list, at sign number 1, and it's something you really can't ignore: a lump in the throat or neck. Discovering a lump, whether by chance or because you've started to feel something odd in that area, is a direct signal from your body that demands attention. Unlike many of the other symptoms we've discussed, a lump is tangible, something you can physically detect, making it a clear sign that it's time to delve deeper into what your body is trying to communicate. Interestingly, these lumps are often not painful, which might lead some to underestimate their significance. However, the appearance of a new lump, or even a noticeable change in the shape or contour of your neck or throat, is a significant indicator that something may be amiss. It could be a swollen lymph node, as we discussed earlier, or it could be something more directly related to the tissues in the throat. In the context of throat cancer, a lump in the throat or neck could be an early sign of a tumor developing in the area. The throat and neck are filled with a complex network of glands, tissues, and lymph nodes, all of which can be affected. A lump could be your body's first visible response to cancerous changes happening inside, serving as a physical manifestation of the disease. Given the direct and tangible nature of this symptom, it's crucial to take action if you discover a lump or notice changes in your throat or neck's shape. While not every lump is cancerous, it's important not to jump to conclusions. Many are benign. However, only a medical professional can provide the clarity and diagnosis necessary to determine the cause and, if needed, the appropriate course of action. So, if you find yourself noticing a lump that doesn't go away, or any significant changes in your neck or throat, it's definitely time to reach out to a healthcare provider. Getting it checked out is not just about easing your mind. It could be a vital step in identifying and addressing potential health issues early on. After all, when it comes to your health, being proactive is always the best approach. And there you have it, the 7 signs and symptoms of throat cancer. It's crucial to remember that early detection can make a significant difference in treatment outcomes, so knowing what to look out for and listening to your body is key. If this video has shed some light on throat cancer symptoms for you, please consider giving us a thumbs up. Your support means the world to us and helps us continue to provide valuable health information to everyone who needs it. Haven't subscribed yet? Now is the perfect time to join our community. We're all about sharing health tips, medical insights, and wellness strategies to help you live your best life. Plus, subscribing ensures you won't miss out on our latest content designed to keep you informed and empowered. Got thoughts, questions, or experiences you'd like to share? We'd love to hear from you in the comments below. Your feedback not only enriches our community's conversation, but also helps us tailor our content to better meet your needs. And don't forget to hit that notification bell so you'll be the first to know whenever we post a new video. For those who want to go the extra mile in supporting our channel, the Super Thanks button is a fantastic way to show your appreciation. Every bit of support helps us keep creating content that makes a difference. Thank you for watching, and remember, being informed is the first step toward taking control of your health. Stay vigilant, consult healthcare professionals when in doubt, and take care of yourselves and each other. Until next time, stay healthy and stay informed.